Today we have presenting Bonnie Copenhaver. She's with New River. Um, and Bonnie, whenever you're ready.
Okay. Well, I do appreciate this opportunity to talk about New River. I always love places to talk about New River, and I will go anywhere to talk about New River. So if you need somebody to come and talk about what we do, I am more than happy to do it or find somebody that can do it if I can't. But just so everybody knows, New River serves 9 counties in this part of West Virginia. We serve those 9 counties with 7 locations. So 4 of those locations are considered what we would call a campus. So the bigger facilities that we have are here in Beaver, which is our main campus in Raleigh County. We have a campus in Princeton, in Mercer County, a campus in Lewisburg in Greenbrier County, and a campus in Summersville in Nicholas County. We also have a site in Summersville. That's our newest location. It is on the campus of the SCAR-H hospital there, so Summers County ARH facility. That facility is a partnership between SCAR-H, bigger ARH, and we teach licensed practical nursing students there. That county had lost their LPN program. So the hospital renovated space for us, and we now have a fully approved site for nurses, and I can add other things there if I want to. We have an advanced technology center, which is in Gent. That's another large facility for us. It's predominantly for technical programs. So welding is there, electrical distribution, those are the people that climb the light poles and fix the lights. We do HVAC, auto and diesel repair, and CDL. Truck driving out of that site. And the final site we have is in Pocahontas County, which is probably one of the more remote counties that we serve, that and Webster County. Pocahontas County, we have a one-room university in Marlington. It's a partnership, a long-term partnership between the city of Marlington and the college. Students can go there, access especially high-speed internet, which is, if you've ever been to Pocahontas County, is not great. For a multitude of reasons. Students can drop off things, take a class that might have a Zoom component so that they can have stable internet and a place to function. New River's main priority is to train either students who want to transfer, students who want to go straight to work, and then workforce development training. So workforce development training is considered non-credit. So like, for example, if your organization needs training in Excel or in Access, we can come in and provide that training at a very reasonable cost for the business or industry. Some of our programs are listed both for credit and non-credit. Electrical distribution is one of those. You can either get a college certificate, actually graduate, or you just do the workforce part. And then that makes you employable. So we do blur those lines quite a bit. For the students that want to transfer, we do have articulation agreements. So students can start off at New River, say they want to be psychology major. We can help them through the basic things for psychology, social work, anything like that. And then they transfer to the university of their choice. In some cases, that's junior status. And in some cases, especially at Marshall right now, if you have an Associate of Applied Science, which is the welding degree and IT, things like that, that aren't considered transfer, they're considered to go to work, but Marshall will take up to 70 credit hours, 72 credit hours, and get you on your way to a bachelor's in general studies. So that if you do want to continue education, we try to find ways to do that. I am very, as a person and as an educator for all my life, all my entire career has been spent at community colleges. So access to me is important. Community colleges do serve those who are generally denied access, either financially, socially, culturally. It's a wonderful place to be when you see those students that never thought they could ever go to college and watch them succeed and grow, which is why prison education is very, very important to me, because it is very much an underserved population. And when I think about prison education, I think about prison education in two ways: actually going into the prison and delivering education, or working with students as part of their reentry plan. Because it is now very much proven in the literature that a college education, college certificate of some sort, greatly reduces recidivism. We used to think it was a high school diploma that did that, but it really is. It's the actual fact of continuing that education, either while the person is incarcerated or when the person gets out. It's always a barrier. Of course, in prison programs are very controversial, which I never understood why. I think people are just cranky and don't want to allow somebody who is incarcerated the full benefit of education. But that to me is, I will argue probably to the death with anybody who thinks that people who are incarcerated should not be educated. I think that's just wrong. I know that people who leave prison are also, the cards are stacked against them, and having access to federal financial aid and some of those other resources is much easier now than it used to be. In the past, New River has actually taught classes, I think, at the Southern Regional Jail, and we've done some things at FCI Beckley. I know our technical dean and technical instructors have gone to FCI Beckley and done an evaluation of the educational programs that they already have in-house. And we are more than happy to do that as well. We've had some conversations with Denmark Correction and Anthony Correctional Center when it reopens to be able to provide there. It's tough for us because sometimes the funding will ebb and flow that pays for programs, for us to be able to have programs in prisons. One of the things right now that gives me a lot of hope is the ability to become an institution that can award Pell Grant or federal financial aid to people who are incarcerated. This is a recent change over the past couple of years in policy and in practice. One of our sister institutions, WVU Parkersburg, is actually working through the process right now to apply to become a prison Pell eligible institution. New River will be waiting our turn to apply for that. I think the state only wanted to do one institution to figure out how you do this because it's a very, very complicated process. And once they figure it out with Parkersburg, then they'll be able, hopefully, to take on others of us who are ready, waiting, and dying to do this. What we would do, what our vision would be for delivering education once we can become Pell eligible, we would do mostly career and technical programs, and be able to walk students through things that they actually could work in the world once they leave incarceration. We also have no problem with looking at how to do students who are incarcerated for a longer period of time to be able to work toward their bachelor's degree program. So we would get them started on those transfer options and then help them facilitate going through. But it is our goal for anything that we offer in the prisons, it will either be fully transferable or it will be leading straight to work once someone comes out of incarceration. So I know just that getting people who have been justice involved into the workforce is a challenge at best. Some of our faculty do know about employers who don't mind taking justice involved people. And New River is perfectly willing and very, very willing actually to work with groups like reentry councils is to help make that conversation about education part of that reentry experience. Obviously, people who are coming out need driver's license and they need their basic needs met, which I have no problem with that being the first priority because you do need to live and feel secure where you're living before you can take on something like education. But I do think as we go down our journey, to be able to connect with people through Pell. I'm also willing that if y'all work at other facilities where we can get in and teach a class or two, we are more than willing to do that. It is a very slow process for us, which I hate on several levels. And there's lots of turnover sometimes on the facilities end, so that you get started with one warden or one educational director, and then you get a new warden or a new educational director, and then it all goes away, and then you have to start back over again. Which sometimes happens when we work with transfer institutions. So it is something that that we do deal with. But I wasn't real sure until getting ready for this how far along we were to be becoming Pell eligible, and was disappointed to learn that we're going to have to wait our turn after Parkersburg. But the president at Parkersburg and I are pretty connected, and we work together quite a bit. So it gives me another resource to be able to say, hey, how's this going for you? What can I do to get ready, so that when it is our turn, we'll be ready to go. And I think somebody put, let's see, did I see? Oh, where is it? A new person at FCI Beckley. Thank you so much for that. Thank you, Erica. I will take down that name and contact information and make sure that I follow up with that, and have my staff follow up with that as well. I'll take any questions or comments or concerns or anything New River could do better to serve this group and those who are incarcerated. I'll be more than happy to have that conversation.
Well, I know you and I have talked before, but I spent 13 years in higher education, so to bridge these two things together is incredibly important to me as well. And we had, and I'd like to see how you guys handle it. The application does not ask anything about your admissions application, doesn't ask about anything. So how do you vet students to say that this is the program you're going to be in, but they may not disclose anything, but then you can find out as they're ready to graduate, you're not eligible to work in this. So
yeah,
we that was something we tried to get advisors to be open and have those conversations with their students early on.
Yeah.
How do you feel that?
I do. Most of the time we figure out somebody has been justice involved when they do federal financial aid paperwork. Yeah. That's usually when it surfaces. Generally, the programs that we see that population gravitating to, we can find them a job. Mm-hmm. Now, where I get frustrated is if somebody's worked as a medical assistant and been trained to work as a medical assistant while incarcerated, and they come out and they want to work and they can't. We've had a few that wanted to go into education that we've identified and said, I wish this were different, but I can't. I was hesitant to put anything on the application that asked about incarceration. I didn't want it to be that check the box moment where they felt like it was all over because they've had to answer yes to a question. So how we navigate that and how we have that come to light, I think is still very much tied to that stigma that's around previously incarcerated people, as well as people feeling uncomfortable. You're my brand new advisee with my success coach. How do you ask, hey, have you ever been incarcerated? Because people could get ultra offended when really your goal was trying to just make sure that you're matched with a program where you can work.
Right. Yeah.
It is very difficult, to do that. And I think sometimes it's been made easier for me because of people I've met through this group or Prevention Coalition or whatever. They're going to say, hey, I've got this person who help me with this person. So it comes on a more individual level than right now, which is not the best. But until I have a way that makes everybody feel accepted and not traumatized or stigmatized by having to check a box. Mm-hmm. Yeah. So I'm open for that. Yeah. It's tough. It's really tough because you have previously incarcerated people who don't want to share, which I completely understand. You have some that are more open with sharing. It's probably one of the hardest things to have to deal with. People are much more willing to talk about any substance use disorder. Even that's tough, but they're more willing to talk about it and how that might impact their educational experience than being incarcerated.
That's, one of the things I always, time is a big thing. And oh, well, I don't have 2 years. I don't have 2 years, that they're used to looking at time from a different perspective. And so
Yes.
I'm like, let's break this down by degree, diploma, certificate, and
Yes.
let's break it down into, you can get the certificate in 8 weeks or 16 weeks. And, a lot of the moms, I'm like, you were pregnant for 9, this
This
semester is half of that. So
this is not. Yeah. And we have lots of, even for non-incarcerated students, that time thing of, oh my gosh, I can't do this. Or no one in my family's been to college, and this 2-year degree seems so daunting. Okay, well, let's start with the certificate, or I'm going to put you in a workforce class that has no grades, no nothing, other you pass fail kind of thing, and then I can take that work and translate it into credit if you want to keep going. Once you've established that, oh, I am smart enough to do this.
Yeah, that confidence. Absolutely.
Yeah.
Who else has questions? Do you have the
No other questions for Mrs. Copenhaver?
Do you have the PRSS program, or not PRSS? What is
Collegiate? Peer recovery certification training. Yes, we do that as non-credit, and offer it 2-3 times a year.
Is it a paid class or is it a free class?
You have to pay.
Okay, that's the way it is. They just started offering that here, so.
Yeah, it is that. I have a new person in our social services program. So I'm giving her some time to get her feet situated, but I'd like to be able to transition that peer recovery into an associate degree track within our social services program. That is my long-term goal, and I'd like to make it more of a short-term goal. But like I said, we have a brand new faculty member, and I need to give her about a year to get her head screwed around everything that we're doing. So I do want to make that, though, a degree offering that we have.
Awesome.
I do. This is Dominique. I do think that would be amazing. I know in a lot of situations, as a peer myself, there's some things that we as peers can't do in like treatment facilities and things like that. Now I know that I believe if you have 2 years experience, you can do the substance abuse counseling as a peer. But I know that I can't do any case management things, which would, include like probation officers and home confinement and things like that, because I don't hold a bachelor's degree,
right,
or any degree, associates or bachelor's. So
Dominique, you know my speech I'm going to give you.
Oh, I know.
Dominique and I have a long running thing about this, and we're ready whenever Dominique is ready. But it's actually true. And actually, huh?
I said it's a commitment thing for me.
I understand that, and she's not the only one that has that. Believe me, Dominique is special in lots of ways, but not because of that. It is because it is a commitment. I mean, I totally get that, but it is. The state is now allowing people with a 2-year social services, or basically what you would call social work degree, to be able to work more in other places and do other things. And we do have some students that are in that pilot program. That group just graduated last year, and they're able to work more actively in the social work field than they would have been at the 2-year level. And I'm hoping that that's going to become more of a statewide thing. And that kind of addresses what Dominique is talking about, is the ability, you have the knowledge to do it, the experience to do it, piece of paper getting in your way. And I hate it when pieces of paper get in the way for no good reason, or to be able to work on that piece of paper while you're doing more important work or deeper work with the clients that you serve.
Brittany, did you have your hand up a minute ago?
She was clapping.
Oh,
I
okay.
was clapping. I liked what she said there.
Yeah, about the peer recovery track.
Yeah, I think it's a really great idea, and I think that it's really something that's needed.
I pushed that for a very long time where I'm at. We were part of 16 colleges across the state of Kentucky. And so I went to my supervisor and to the academic dean, and I would get, well, but it's not successful in other parts of the state. I said, well,
Who cares?
I said, they're not Eastern Kentucky,
They're not
Jacksonville
Kentucky.
doesn't have the same demographic and same issues as we do in Eastern Kentucky.
Yeah.
And I said, I'm the one that's going into all the recovery homes and all of the facilities. I see it. And, I actually got into a heated debate with my supervisor of, well, how are they going to pay for it? I said, you do not ask that of any other student. Why are you asking that of these?
Why do you ask that? Yeah.
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 Yep. Bye, Jen. All right, Madam Chair, Ms. Dominique, what else?
All right, well, we have the isn't it the West Virginia Restorative Justice week coming up? And sorry, I'm trying to get my notes here so I don't get anything wrong. Oops, sorry. Okay, so that's going to be coming up. Oh, goodness, November 20th. It's going to be a talking circle, and it's going to be for statewide. It's a free event, but registration is required. It's going to be on the 20th of November from 4 to 7. And then we also have, not as the Reentry Council, but coming up, there is a West Virginia Prevention Summit on November 14th at the Charleston Convention Center, and an ORN Summit October 29th and 30th at the Chief Logan Conference Center in Charleston from 9 to 5. That one is free as well, and it offers CEUs. I myself, I'll go ahead and introduce myself and tell everybody what I do, and then we can kind of go from person to person. If anybody has anything that they would like to share, any events coming up or conferences, anything. But my name's Dominique Marcus. I'm a peer recovery coach. Right now I'm working at Veltex Recovery Group in Mount Hope. It is an all women's facility with 60 beds. Right now we're about halfway full. We offer MAT and 12-step program. They're in group for, I think 6 hours a day, Monday through Friday. And then they also have one-on-one counselings with their peer recovery coaches, as well as their case managers. So we keep them pretty busy, load them up with all the tools that they need to be able to succeed once they leave. We help them get into sober living after they leave, if that's what they need. We send reports to day report or probation officers, whatever it is that they need. We do it for them. I'm also the chair of the Raleigh County and Fayette County too, Reentry Council. And I wear a lot of hats. I do a lot of different things. I do Save a Life Day. This year we had to kind of put it off. The rain from that hurricane, whenever it hit us, it went. We were out. There was 2 locations, and we ended up getting rid of, I think it was like 360 doses on that rainy day. So that was actually pretty good. So, but I'll go ahead and pass it on to, we'll do Carla.
Hi guys, my name is Carla Mollahan. I work with Unicare. I'm a health promotion consultant in the population health department. So I work in 19 counties in the southern half of the state, and basically I find resources or community-based organizations that can help our members meet those social determinants of health needs, whether it's education, employment, housing, clothing, food, anything like that. So I'm always looking for organizations that I can pull and have in our private database so that we can reach out to our members one-on-one who may need help with those things and get them the services that they need. Dominique, I would love to meet with you and discuss more about your new role in Fayette County. So I'll put my contact info in here. Reach out to me if you wouldn't mind.
Wonderful. I definitely will.
Yeah, and if there's anything that I can do to help any of you all, I also do public public education on any health topic. So if you have a group or an organization that has meetings that you know would benefit from a certain health topic, anything's on the table. Anything that you'd need there. If I don't already have a presentation for it, I will create it. But more than willing to come out and help. Just let me know.
Thank you. Would you like to pick someone else to go now? We'll just go down the line and we can pick after we're done speaking.
Sure, let's go with Erica.
Can you hear me?
Barely.
Okay. I will try to talk. These don't usually work at the prison here, but I will try. So I am at FCI Beckley, and I was actually getting ready to type you an email, Carla. If you would ever be interested in coming to one of our health fairs, we do health fairs for the inmates, and so we are always needing resources to set up to discuss different health topics with the inmates. But if anybody else is interested, we also do resource fairs. I put my email in the chat. If anyone is interested, just reach out.
Thanks, Erica. I actually did get to come to one of the resource fairs in the spring. So yeah, hit me up. I would love to come.
Great. I will put you on the list for a possible health fair as well. Thank you.
All right, Erica, did you want to pick somebody to go now?
Let's go with Seth.
Hey, good morning, everybody. I'm Seth Hansen. I'm the Partnership Development Manager with Groups Recover Together. We've got 7 locations throughout the state. Closest to you guys would be Beckley there on Robert C. Bird Drive. And we also offer a telehealth option as well, a virtual piece. So let me know if you have any questions. Thanks for having me. Let's go to Keith.
Hey, good morning, guys. It's Keith Bowling with Aetna Better Health of West Virginia. We are one of the Medicaid providers in the state of West Virginia. So if you have an individual who is coming out of incarceration or if they qualify for Medicaid services and we are their provider for those services, then I can always provide information and education to that person as to what they have available to them and how to get a hold of their case management team and those types of things. And I'm going to pick, it says PC.
Yes, it's Phyllis. I work for Central Office in the Bureau of Prisons and Reentry, and we're always looking for volunteers and partnerships in the community. I still attend these meetings so I can know what's going on locally, and if I need to reach out to anyone about services or anything that's going on, I still will maintain those contacts. So I appreciate everything that you all do for the returning citizens that we have going back into the communities. Thank you. I don't know who is left.
I think Brittany.
Okay, Miss Brittany.
Hello, everyone. So I am Brittany. I am the lead peer recovery support specialist for the Jobs and Hope program. What we do is work to eliminate any of the barriers that stand between the participant and their goal career. Most commonly, we see a lot of justice impacted individuals who are just trying to overcome previous incarceration, put their past behind them, and get a career that they can be proud of. So I don't think anyone's left, but I couldn't tell, so I don't know who to pass it to.
Well, I think Krisha would be the last one.
Okay.
All right. So Dominique, most of the things that you mentioned, the events, I dropped the flyers over in as you were as you were talking about them. So Restorative Justice Day is on the 20th. And if anybody's interested in becoming a trainer or to learn how to do circles of support and acceptance, we definitely need more of those. The ORN is at Chief Logan. I've gotten a lot of feedback about that there's not a whole lot of information about where it is or who to contact. I didn't make the flyer, so I can only share out what I have. Leading for Justice Summit is in Charleston in January. So once I get the official registration link, I will send that out. Bev Sharp, our executive director, is doing a Build Bridges to a Better Community in Charleston. I gotta remember which she does one day and I do one on the other. She's doing November 6th in Charleston. It's a great community program. So it teaches people what actually happens versus what you think happens when you're coming out. It works with employers, community services, things like that. So it's just a one-day workshop. And then on November 13th, I'll be doing a trauma-informed care training in Charleston also. And it is it's geared more towards criminal justice response. So anybody, any of us, or, Brittany, if any of your people at Jobs and Hope would want to do it, or Bonnie, if anybody, it's just how to not re-traumatize, not to impose stigma, how to use non-stigmatizing language and things like that. So both of those workshops are free. So there's those flyers, and I'll send them out to everyone later on. And then I guess the biggest things with the REACH, we were awarded an Appalachian Regional Commission ARC Inspire grant. So that was a tough one.
That's tough.
Yeah. So we will do, we're focusing in Lincoln, Logan, Boone, Mingo, McDowell, that area. We have our volunteer Breach Back Reentry navigators, who are people with lived experience, and then mentor someone for a year. We are now going to pilot that as a paid program because it is important, and to help someone that has successfully navigated those barriers to help someone else get through all of those hurdles, getting your IDs and finding employment and education and all of those things. So that's what our focus is for the Inspire grant, is to show the feasibility and the validity of having that as a paid position, much like a PRSS or something, but this is someone that is in reentry and or recovery. And then the other program we have is with the Claude Worthington Benedum Foundation grant. And it takes that same reentry navigator, but also pairs in a community health worker. So Coalfield Health is providing the community health worker to help work on those social determinants of health. Of you're coming out of incarceration and you have never had to self-advocate for your healthcare, and you've never had the choice of doctors and physicians, and what kind of treatment you receive. So how to do that, and how to manage your long-term diseases of blood pressure and diabetes and things like that. So the two will work together simultaneously to help people as they come out of incarceration. So we're doing lots of big things and trying, serve people to see, there are lots of services and helps available. Those are the biggest things. And then, I've written a ton of smaller grants for different areas. So, if there's anything for this area, like a local foundation, let me know about that, and I will be happy to write grants. That we did one for Parkersburg for the Ruth Sisters Health Foundation, and I've done one for Palatine of Huntington to be able to purchase duffel bags that are sewn by inmates. It's through Prison Industries. They're large duffel bags, they're weatherproof, they have backpack straps as well as a handle. And then we purchased those, and then full-size hygiene products, socks, t-shirt, underwear, Mylar blankets, can openers, basically 3 days worth of supplies, because if you're released on a Friday and it's a holiday weekend, it may be Tuesday before you get to see any services. So we have at least 3 days worth of supplies in those duffel bags, and we distribute them to probation and parole, the day report centers, anybody that will be working with someone as they come out. So Dominique or Bonnie or Brittany, if you have anybody, a local foundation, let me know, and I'll be happy to copy paste on a grant.
Well,
Thank you.
I have just started I'm hoping to get the 501c3, but another chance harm reduction and outreach. That was something that I have started here recently, and still trying to get all of the things, in order that you need to become a nonprofit. But eventually, hopefully sooner rather than later, we can get that ball rolling, and definitely need grants. Definitely.
That's
All right. Does anybody have any questions? Okay, well, I guess we can go ahead and close the meeting. Our next meeting will be November 18th. And if anybody needs anything before then, they're feel more than welcome to reach out to me. I'll get back to you as soon as possible. Sometimes, especially if it's an email, it might take me a few days. But I'll always respond back. But you guys have a wonderful month, and I'll see you on the 18th.
Thanks.
everyone.
Thanks.
Bye.
Bye.
Thank you, Bonnie.
No problem. Glad
Thank
to
you,
help.
Bonnie.
No problem.